This year, as the COVID-19 pandemic ravaged the entire world, people everywhere suffered unimaginable pain, both physically and emotionally. Illness, death, despair, and uncertainty were our constant companions. As we continue to face down the pandemic, our world has never been in greater need of repair. In response, this center, the Center for Disaster Medicine, is helping fulfill New York Medical College's mission to offer solace, hope, and service by protecting the health of New York citizens and those around the world who look here for guidance.
No, we are here to thank members of the New York State Senate for their tremendous support, and including an unprecedented $1 million in this year's budget to support the mission of the Center for Disaster Medicine.
Despite our sophistication, both politically and scientifically, in the current century, we've been faced with a number of huge surprises. 9/11, Hurricane Sandy, Katrina, the COVID pandemic, and just this past week, the terrible collapse of a residential tower in Surfside, Florida, in Dade County. Despite everything we've accomplished as a society, disasters, both natural and man-made, still happen. And that's why the Center for Disaster Medicine is so important. Because regardless of where we think we are, we know, unfortunately, that these challenges will happen in the future.
Now, here we are in 2021, and we know there's no typical emergency. We know that there's no one way to handle anything that happens. And we know that the responsibility of making sure that the public service and the public safety is secure falls on government and falls on our healthcare system in a whole lot of ways.
And I very early on realized the importance of this center, both medically and as a jobs creator, as an economic engine, as an economic multiplier. And you know, we've heard about the major disasters. Last night, I spent with a family who had, the night before, their house burned down. They barely got out with their 4 kids. The roof collapsed. They lost everything, but they got out. But imagine if they hadn't. Would the first responders have been able to triage 6 burn and collapse victims? Would the local community hospital be able to handle that? And that's what New York Medical College does. Yes, we train for the big disasters that we hope and pray never come, but there are hundreds of little disasters every day all across this state. And that's what the medical college also helps us prepare for at a grassroots level. And that's why it's so important. And then the other thing is the economic engine. As you see, all of the people standing here live here in Westchester. They're paying rent, their mortgages, the students buying food. So supporting this, yes, it's a great academic and medical institution of the highest caliber. This is an economic engine.
I want you to know that you have an advocate in all of us, in my conference with our leader. But I can tell you, it's not just the leader and Senator Harkin and myself. This majority conference believes in everything that you do, the hard work. We're playing a very small role and trying to get you the funding and the resources that you need to do the great work that you do for our entire state.
Not only through a very trying budget year was our funding maintained, it has been increased. And just a few things, that increase will let us do many more things. We have many first responders who are here for training. Without that additional funding, this type of training would not happen. We've learned that schools need better health preparedness as well as mental health preparedness to deal with these types of events. That will be new training that we've offered in the past, but we're expanding. We've always talked about mass casualties, but mass casualties have new realms. And businesses that have taken a taste of continuity of operations are now thirsty for it because they've understood that their survival is based on the ability to, quote unquote, weather a storm and get through an emergency.
We honor those who have chosen to lend their support to this center. We express our thanks for senatorial support, and we promise that at New York Medical College, great things are happening to make this world a safer place, shielded from the ill stars. Thank you.